On this Monday night, Canada's first shots. The country's mass vaccination effort is underway.
Less than a year ago, no one believed it would be possible to get this vaccine out.
Who is getting the first doses? Plus, new details on how the complex plan will unfold.
There are so many moving parts in this process.
And how soon could a second vaccine be approved? The critical message to Albertans.
They see the vaccine getting started, and so people erroneously think this is going to be over quickly.
And the meaning of this moment of hope near the end of a devastating year.
Global National with Donna Friesen.
Finally, a moment to celebrate after an agonizing year. This woman, a personal support worker at a Toronto nursing home who has worked countless double shifts, is among the first Canadians to get a COVID-19 vaccine. Good evening and thanks for joining us. It is happening. The first doses of the Pfizer-BioNTech vaccine have been delivered and Canada's mass immunization campaign is underway. The first shots were given in Ontario and Quebec. 30,000 doses are expected to arrive at 14 sites in all 10 provinces by the end of this week. Some are calling today V-Day. And Canada isn't the only country celebrating. Vaccinations also began in the U.S. today. One of the first people to receive one was critical care nurse Sandra Lindsay. She works in a New York City hospital ICU.
I feel hopeful today, relieved. I feel like healing is coming. I want to instill public confidence that the vaccine is safe. We're in a pandemic, and so we all need to do our parts to put an end to the pandemic.
In both the U.S. and Canada, the plan is to roll out the vaccine to the general public early next year. For now, with supplies limited, doses are being reserved for people considered the highest priority. Eric Sorensen begins our vaccine coverage tonight.
It's reminiscent of emergency air supplies to the developing world, only it's Canada. The resources of government, science and logistics being brought to modern-day disaster relief. The first needles prepared at Toronto's University Health Network, specific location withheld for security reasons. The first recipients from the Rakai nonprofit long-term care centre, frontline workers who battled outbreaks and death at their facility. Anita Kidangan, for 30 years a personal support worker and among the first in the country to get a COVID-19 shot. How did it feel?
I'm okay. I'm excited.
Yeah, why?
Because I'm the first one to get the vaccine.
4 more care workers who, like so many Canadians, risked their safety, also now getting protection.
We have been waiting for this for so long, and I'm here now, and I'm so thankful.
It's an historic moment in a pandemic that has sickened and killed thousands in this country.
Today, really, we turn the corner. I like to say this is the shot that will be heard around the world, literally. And we're going to really start conquering this illness thanks to you.
The Pfizer-BioNTech vaccine, the first of several that Canada has contracts to receive, requires ultra-cold refrigeration. They're going to 14 centres equipped with special freezers in all 10 provinces. The first 30,000 doses being divided up this week represent just a fraction of 1% of what will be needed in the months ahead. But less than 1 year after COVID-19 swept into Canada, Ontario's Premier was there to witness the arrival of medicine that it's hoped will return the country back to normal.
Make no mistake, there's a long road ahead of us. But what this represents is hope and proof that this pandemic will come to an end.
Experts insist there have been no shortcuts on safety.
The speed is the result of a singular focus of the entirety of civilization on one problem. And when money is no object, magical things can happen.
And so the first publicized needles also kick off an effort to reassure Canadians the vaccine is safe. The boss at the Rakai Centre said she was challenged by her staff.
If you get it, then I will get it. So I'm here, I'm taking it for the team. We're doing this not only for ourselves, but mostly for our residents and their families so that they have faith in us.
Canada has contracts for so many vaccines that it could potentially receive enough not only for all Canadians, but ultimately enough to share with other parts of the world. Eric Sorensen, Global News, Toronto.
Vaccinations also began today in Quebec, where the first doses went to long-term care homes. The Pfizer-BioNTech vaccine needs to be kept ultra-cold, and in many jurisdictions it's been deemed too complex to move beyond vaccination sites inside hospitals. But Quebec overcame that, and as Mike Armstrong reports, some of the most vulnerable Quebecers are now the first to be protected.
This was the first vaccination in Quebec.
Je vais aller, Madame Lévesque, je vais piquer, okay?
89-year-old Giselle Lévesque didn't bat an eyelash. When it was over, she simply asked the nurse if it went well and was told it had, followed by this moment.
Amanda, I made it!
Quebec's first shipments of Pfizer-BioNTech vaccine went to 2 long-term care facilities, one in Quebec City, where Lévesque was vaccinated, and this one in Montreal.
Yeah, here you go.
First up at the Maimonides Geriatric Center was Gloria Laluz. The 78-year-old has lost 8 friends to COVID-19. She's been so scared she hasn't left her room in months.
C'est tout?
Getting the shot, she says, couldn't have been easier and couldn't have been more important.
Everybody has to get a vaccination. It's the only way we're going to be able to live.
Quebec took delivery of 5 boxes of vaccine, enough for about 2,500 people. Now, where most provinces are setting up vaccination centers and will move people to those sites, Quebec is trying to go another way. It's prioritized the most vulnerable, seniors in long-term care facilities, so it's sending the first batches there. Parallel to vaccinating residents, they're also going to be vaccinating healthcare workers. But Pfizer-BioNTech doesn't allow the vaccine to be moved, so once the doses are in the freezers at long-term care facilities, that's it.
They have to come here. Until the last dose, they have to come here.
So each one.
Quebec is hoping once Pfizer-BioNTech sees the process can be moved around, it may loosen some of the rules.
I think with the time, over the next few days, they'll see that we can vaccine properly.
Now, as this good news drops in Quebec, there may be some rough news coming. The Premier is set to announce a lockdown Tuesday, effective after Christmas. It would include the closure of businesses deemed non-essential and extending the holiday breaks for schools. Mike Armstrong, Global News.
Thank you.
Montreal.
This is just the beginning of a long and complex rollout that is intended to reach every person in the country. It involves everything from shipping specialized freezers to developing smart communication strategies to convince hesitant Canadians to roll up their sleeves. David Aiken reports on what we know about those plans.
There are so many moving parts in this process of the largest mass vaccination that our country has seen.
Vaccines are Ottawa's top priority, so Public Services Minister Anita Anand gets on the phone herself with Pfizer's CEO to make sure Canada gets its share of doses.
I said 30,000 this week. I did not say 30,000 next week. I said a similar shipment. I'm trying to confirm that number for next week.
And while Anand haggles with Pfizer, she also has to find somewhere to put the vaccine when it gets here. To that end, her department is buying up freezers by the dozen. Orders have been placed for more than 400, including the ultra-cold models that can store the Pfizer-BioNTech vaccine at minus 70 degrees Celsius. 42 freezers have been delivered so far, and they've been shipped to various locations around the country. Next up, a communications campaign to ensure Canadians that the vaccine is safe. It's a campaign experts say is overdue.
It's time to start leveraging pre-existing networks and really speaking with community leaders that represent various communities throughout the country to really ensure that people have access to the best information so that they can help make informed decisions when vaccines become available. And it's not going to be easy, but it's certainly something that has to be done.
Canadian security agencies are already fighting online disinformation campaigns. More than 3,600 fake government websites trying to pass on incorrect or misleading health information have been taken down, according to the defense minister.
First thing what's concerning to us is the disinformation that's out there. So we need to be able to counter that.
Meanwhile, Health Canada officials are working overtime to approve the next likely vaccine from Moderna and hope to give it the green light by year end. David Aiken, Global News, Ottawa.
In Alberta, there's no sign the spread of the virus is slowing. Nearly 2,000 new cases were reported there today, a new daily record, and 15 more Albertans died from the virus. The province has received its first shipment of the Pfizer-BioNTech vaccine, 3,900 doses, and the province says it expects more than 25,000 to arrive next week. The first shots will go to healthcare workers in Calgary and Edmonton. Hospitals and ICUs in much of Alberta are full. Tougher public health restrictions are now in place in that province, but it's going to take time to see the impact. And getting some people to comply could be a battle in itself. Heather Urix-West reports.
He's become known as Mr. COVID, a funny, if not nightmarish take on the virus that has changed all of our lives.
Our goal is to get people's attention, to help them see common situations from a different perspective, and as a result, to influence their behavior.
Dr. Hinshaw says she knows some people are now tuning out her daily updates, and even though the ads rely on humor, there is nothing funny about the situation at hand.
I think people are tired of the pandemic. I think that they see the vaccine getting started. And so I think people erroneously think that this is going to be over quickly. And unfortunately, it's not. And it makes me sad to think of all the lives that are going to be lost.
The number of COVID patients now flooding into Alberta's hospital wards could soon put the entire health system in jeopardy. So getting people to comply with current public health orders has never been so important. Yet every Saturday without fail, Alberta's major cities have seen rallies protesting the measures aimed at keeping people safe. On Monday, Calgary City Council voted to increase penalties for people who refuse to comply.
At this point, everybody's got a mask. Everybody knows the rules. And so if you're not wearing your mask, it's not by mistake.
Fines generally don't work. Positive things do work.
This University of Alberta psychiatry professor says behavioral science research is pretty clear. If you want people to change what they're doing, you have to use a combination of carrots and sticks. Restrictions need to come with rewards.
So how can you reward people for not gathering? How can you reward people for wearing masks in public? I'm sure people could come up with creative ways of doing that.
Offering safe alternatives is important too. Montreal is making outdoor spaces more appealing, while Calgary has outfitted its parks with temporary fire pits, providing some warmth through the cold months ahead.
If we're going to be successful, we need a number of tools, and they all need to be aligned together for this to succeed. Otherwise, I am very fearful about what will happen in January and February in this country.
The new year positioned to become the pandemic's deadliest period, unless the behavior of many changes fast. Heather Urix-West, Global News, Calgary.
The Saskatchewan government is tightening public health restrictions for the holiday season and extending them until January 15th. Starting Thursday, all private indoor gatherings will be limited to immediate members of your household, with some exceptions. Outdoor gatherings will be restricted to 10 people. Bingo halls and casinos must close on Saturday, and personal care services like hair salons must cut their capacity in half. Effective Christmas Day, retail stores in Saskatchewan must do the same, and large retailers will be restricted to 25% capacity. A new strain of COVID-19 could be spreading in the UK. Health officials say there is no evidence it is any more dangerous, but it may be spreading faster. More than 1,000 cases have been identified, most in southern England. Parts of the region, including London, will face tougher restrictions starting on Wednesday. Available to all coming up. The lofty goal of making the vaccine accessible to everyone in the U.S., the world's worst hit nation. A pivotal moment in the U.S. today as the first COVID-19 vaccines were given there. With the prick of a needle, the worst hit country in the world was given a dose of hope. An ICU nurse in New York was among the first to get the Pfizer-BioNTech vaccine. New York's governor calls it the weapon that will end the war. More than 300,000 Americans have already died from COVID-19, and thousands more are dying every day. Vaccines won't stop that immediately, of course, but as Jackson Prosco reports today, does mark the beginning of the end.
Those on the front lines are now first in line for the vaccine.
The hardest part by far has been watching people die alone.
In Ohio, healthcare workers were vaccinated en masse.
We need to trust the physicians and trust the scientists. That's why I volunteered to do this.
In New York, nurse Sandra Lindsay became the first person in her state to be inoculated.
I hope this marks the beginning to the end of a very painful time in our history.
But it is just the beginning. An unprecedented effort is now underway to manufacture and ship tens of millions of doses. In the U.S., FedEx and UPS have been tasked with delivering to every state. The precious cargo moves under guard of U.S. Marshals.
It's going to be hard to imagine this going off without a hitch, that there likely are unanticipated issues that are going to arise when you're shipping that many vaccine doses all around the country.
The hope is that up to 6 different vaccines will be available on a widespread basis by late spring, enough for every American who wants it.
By the end of the month of May or the middle of the month of June, we would have produced enough vaccines doses to immunize the totality of the American population.
To get there, the U.S. will have to get through the worst days of the pandemic. The CDC estimates 2,000 to 3,000 deaths per day for the next 2 to 3 months. Models suggest the U.S. is on track to record 500,000 deaths by April 1st.
What do people need to keep in mind over the next few months?
Well, that number one, the vaccine is not going to appreciably impact our lived reality right now. This is the worst of it. And so people really need to keep their eye on the prize, vigilance, practicing everything we've been talking about, no travel, absolutely none.
That means that while an end is in sight, it's not here yet. But increasingly, Americans are willing to accept a vaccine as a way forward. A poll released today suggests that 80% say they're willing to get vaccinated, though half of that group says they'd prefer to wait a little while longer just to be sure it's safe. Donna?
All right, Jackson Prosco in Washington, thanks. It's official. President-elect Joe Biden will take office in January. Today, the 538 members of the U.S. Electoral College formally cast their votes in what is a bit of a bewildering process. President Trump is still refusing to concede, but it's clear Biden won 306 Electoral College votes. Trump won 232. It takes 270 to win. By law, the meeting of the Electoral College must take place today. Their ballots must arrive in Washington by December 23rd. And on January 6th, the ballots will be counted during a joint session of the House and Senate. Joe Biden will be inaugurated as the 46th President of the United States on January 20th. And late today, President Donald Trump tweeted that U.S. Attorney General William Barr has resigned and will leave the job just before Christmas. Barr has been one of Trump's most steadfast supporters. Etna erupts ahead of fiery night in Sicily. A dramatic rescue in Australia after a major storm whipped up all this sea foam onto a popular beach. It engulfed a dog. Her owner ran into the foam and managed to find the dog and pluck her out. Southeastern Queensland and northeastern New South Wales are being battered by heavy rainfall, king tides, and flash flooding. And in Italy, Mount Etna is at it again, launching plumes of ash and lava into the sky. Mount Etna lit up the night sky over Sicily on Sunday. It is Europe's most active volcano. Some ash did fall on nearby villages, but there's no risk to anyone's lives from this latest eruption. A magnitude 2.7 earthquake was recorded on the mountain before this, and there have been more than a dozen aftershocks. Next, delivering hope without forgetting we still have months to go. When 2020 started, we had no idea what we'd be wishing for almost 12 months later. No idea how life would change and that a virus would infect every country in the world. Now our collective wish is simple. We wish life would get back to normal. And today, Canada took the first steps. Today, the first real ray of light of 2020 appeared. A tiny vial, a precious vaccine, a promise that one day the pandemic will end.
I'm so grateful to be the first personal support worker to take this vaccine. We have been waiting for this for so long.
The first vaccinations in Canada are injecting hope into our winter of despair.
Make no mistake, there's a long road ahead of us, but what this represents is hope.
Finally, the virus that has infected every aspect of our lives has been outsmarted. Public health doctors have reason to rejoice. BC's Dr. Bonnie Henry even did a happy dance. Scientists collaborated to crack the virus's code in record time, producing a safe and effective way to inoculate us against it, putting COVID-19 on the defensive, not us.
Here we are in December, and we actually have a vaccine against that new virus being administered, not even within the space of a full year. To my mind, that is unbelievable, and it is a remarkable achievement of science.
But the agony is not over. This image captures it. A Calgary doctor on his knees, head in his hands, calling another family to tell them the bad news. COVID-19 is still killing Canadians by the hundreds. Often they die alone or with a doctor or nurse with them. The relief of the first vaccines is tempered by the staggering losses of those who had no way to fight the virus. Today, Manitoba's chief nursing officer read a letter sent by a 13-year-old boy.
Imagine the suffering and terror knowing you or your loved ones might not live or play in the park or breathe without a machine. Think about the big picture, and we will get through this together.
We are still facing a long, cold winter. It will be essential in the months ahead to do all we can to limit the spread of the virus. But today, with these first vaccines, at least we know healing is coming. And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is the sunset over the Crow's Nest River near Lundbreck Falls, Alberta. There are beautiful spots all over Canada. Please email us yours to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.